There. Hello, all and everyone. Welcome to the discussion meeting of the Mount Lebanon Commission. This wonderful rainy Tuesday. Mr. McGill, can you begin with a review of the agenda items, etc.?
Yes, thank you, Madam President. Tonight's agenda is relatively short. We have the consideration and adoption of a resolution designating alternative names, associate members, and subcommittees for our advisory boards. We have the consideration of an agreement with Indoor Tennis. We've discussed that in the past. And then we also have the consideration of bids for our annual street sweeping program. That is it.
Grand. Okay, well, Chief Haberman, we've all been waiting with bated breath to hear what you've come up with and what you think is the best way to proceed, because we do think this is a great need. So I'll let you take over.
Well, thank you. Well, thank you, Commission. Thank you, Madam President, Manager McGill. We appreciate the opportunity to present to you and the residents of the community, really our research and our plan moving forward to help the residents of Mount Lebanon when it comes to filling the gap of consumers of mental health services, as well as those individuals in our vulnerable populations that we can reach out and we can help and really prevent them from going into crisis and prevent them from escalating to any behavior or interaction with the public that are negative. So with that, I want to thank a whole lot of people. First and foremost, I want to thank the staff at our police department, our records clerks. They did a phenomenal job putting together a number of products for us. And I can tell you that they're top-notch folks. And our records clerks really drove a lot of this data. These aren't data sets that are easily found. They had to build these programs, to build these products. So all of these numbers you see are really attributable to Yvette Grandillo and Jan Ward, and really couldn't have been done without them. So those are sort of the quiet heroes in the background, and we appreciate all the work that they do. And really it emphasizes the fact that it does take a village, and we appreciate all of their hard work. With that, again, both Deputy Chief Shupi and Deputy Chief Ruby have been an instrumental part of developing this program, putting together what are our interests and what we can do and how we can develop this to move this forward. Our internal partners, the fire department, Medical Rescue Team South, Department of Public Works, everybody that we work with on a regular basis, we really want to extend our appreciation on a continued basis with them. Everybody in the municipality, we continue to work well with everybody, and we appreciate their input as we've gone through this program as well. Our external partners include Mary Burke from Outreach Teen and Family Services. We appreciate you being here. Mary Ann McGowan, who's the Chief Operating Officer from St. Clair Health Services. We really appreciate her being here to support our program, and throughout. St. Clair has been a great sounding board for us as we've developed our ideas and as we've really bounced them off of sort of each other to sort of come to a nice program and something we can present to move forward. Again, we have Jordan Sager here and his counterpart, Nicholas from Ross Township. They're the social services coordinator from that department. I think you're going to find that they're going to give you a real good understanding of the day-to-day operations of a social services coordinator and what that means and really what that is. And then we'll add some color to the conversation as we move through the presentation. And they'll be able to sort of give you a real bird's eye view of what it is that they're doing and really what the opportunities are that we can serve our residents as well. They're a very similar size community, demographics are very similar. We thought it was very important that we included them in this conversation. So with that, law enforcement has been faced with a whole lot of challenges, and throughout the year, we've looked to solve these challenges in a number of ways. And if you really look to the national conversation, you know, again, the Center for Policing and Equity estimates that 7 out of 10% of all police encounters nationally involve a person who has mental illness. By definition, we've said this for years, we should not be the answer to every problem. We recognize that, and we holistically embrace that. And what we're trying to do now is to solve that in a way that makes sense for Mount Lebanon. So while our officers have a number of training classes, they have a number of years experience in training, they have everything from CIT to mental health first aid, and a number of really comprehensive training of recognition of different ailments, whether it's schizophrenia or bipolar, or any of the ailments that afflict consumers of mental health services and have early recognition. That real core piece that we miss is that warm handoff and that follow-up. And so when you look at it, you can look and really drill down on what is the piece that is missing for us and what has been. And really, it has been the ability to deliver certain services in a way that makes sense for consumers of mental health services and those in the vulnerable population. So as we drill down on this, this is the piece that we're really concentrating on. If you look at everything we have in our white paper that we presented, it really points to this piece, this warm handoff, this ability to co-respond when available, or at the very least, follow up when needed. And you'll find it's not just a police service. This is a municipal service available to everybody in the municipality, whether it's code enforcement, whether it's fire inspection, and they find a hoarding call or whatever it is. And you'll see this as we go through the conversation. Here in Mount Lebanon, we researched a number of different calls. And like I said, we don't have mental health as a call type. However, our good folks in our records department were able to pull together a real comprehensive look at what in fact we do on a day-to-day basis. And you'll find right now we have projected in 2024, 417 incidents of mental health responses, as opposed to in 2023, we're at 293. You can see that number clearly escalating every year. And that number does not include welfare checks or overdoses, which also have a nexus to mental health issues. As well as substance abuse, which obviously could benefit significantly from resource delivery if the right people are in place to give that and to put that in front of them. So with that, if you look at those numbers and you look at the projection, you can see it's not going down in any way, shape, or form. It's continuing to go up. It's continuing to really almost double in size every year. And because of that, we recognize that we do have a problem. We do have a mental health crisis. We are in the midst of it, and we have to have a way to deliver resources and services to people. And that can't be necessarily with a uniformed police officer showing up at their door. So you can see we had 519 overall calls for mental health services. And again, out of that, 489 did not involve the use of a weapon. Okay. 457 of those did not involve drugs or alcohol, obviously, from an obvious sense. That's a pretty telling number. So that number in and of itself recognizes the need that we reinforced all along in this conversation, is that we need to have people in place to deliver resources to those folks. And it can't be necessarily from a police officer calling somebody and asking them if they took their medication the next day. That's not something that's appropriate. It's not something that's in our purview. It's not something that we're legally able to do. And it's really limiting in terms of if somebody got a call like that, I would question again the validity of it. And I would also say that it's not something our officers are trained in. And again, from the healthcare field or from any other field, they would not recommend us taking on that role or entering into that arena. So if you look at the numbers here in Mount Lebanon, you can see we have an issue, and we can all agree, I think, that it's very taxing in a lot of ways. And you'll see exactly how so here as we move forward. So if you look at the number of calls we have, 68% of those are considered an extended amount of time, which is 11 minutes or above, for at least one officer responding to these calls. If you look at the excess time, 21 minutes or above, you can see it's literally just short of that number. And if you multiply the number of officers times that, you're looking at a significant number of man hours dedicated to this problem. And when we look at that, the repeat calls that we have 62 residences that we've gone to multiple times, 2, 3, 4, and 5 times. You're going to get more of an officer response. You're going to get 3, 4 officers responding to that call because of the propensity, the elevated tendency for those individuals to exhibit violent behaviors or to have negative encounters with neighbors or the police. Because of that, the emphasis is on the amount of time and the amount of man hours spent on this is significant. And really, the reduction of that can be done on the back end should a care coordinator be inserted to get the right resources to these individuals to prevent them from going into crisis. We want to get these individuals as far upstream as we can and as far from going into crisis as we can and deliver those services to them as not to exasperate the situation.
Chief, just real quick.
Yeah.
I'm sorry, just trying to follow the pie chart here.
Yep.
So that 32% you have all others, and I just want to follow. Does that mean that's the 0, the 1 minute to 10 minute category?
Well,
Of the 12 categories, they were in increments of 10 minutes, 0 to 10, 11 to 20, and all the way up to 111 plus. Those that we put on the right side were the 5 highest instances or events that officers spend time on. So as you can see, in the orange, 41 to 50 minutes on a mental health crisis call, or 21 to 30 minutes. That's a long time on a single call for a couple of officers, depending on the call volume of that night. And then again, you see 8% of those calls were 111 minutes plus. That 32% is the other 7 categories of time. So 68% of the time our officers are spending an exorbitant amount of time on calls.
Okay, just trying to get a sense of what that meant.
Yep.
Thank you.
And to give you an idea, that in 2023, that was 32 times they spent 111 minutes or more. And in 2024, that's been 9 times. We spent 111 minutes or more on one call. That's 9 different times. You're spending multiple hours.
You mentioned
Man.
11 plus minutes is considered considerable. I heard right. 21 plus is excessive. What the heck do you call 111 minutes plus?
Again, taxing.
Okay.
But, and to your point though, this isn't just one officer responding to one call. This is,
2.
2 to
At least
3,
2.
sometimes 4 or the whole shift.
Yeah.
Sometimes the lieutenant would be
Yeah.
there because we're trying to get a mental health service to come to the scene. Sometimes it could be, again, somebody having to go and find a relative and taking them to the station, bringing somebody back. It could be a whole lot of moving parts going on, as well as the resources involved, whether it could be an ambulance tied up. The fire department may have sent a quick response because it came in a certain kind of way. You know, this is the kind of thing that happens where we can't guarantee what comes in a 911 is a call. And that's also the difference of why you can't rely on another silo response with 911. We can give you hundreds of examples of calls that came in one way, you show up and they're a totally different scenario. And so a lot of times we'll get a call, an unknown medical problem, an elevated medical problem. That will elicit the fire department's QRF, MERTS, it will elicit a police officer. You get there and it's somebody in mental health crisis that a neighbor called about and said, oh, I thought they were unconscious on their porch whenever I saw them. And then next thing you know, none of those earlier symptoms were exhibited, but now it's a completely different type of call to handle. So because of that, it's really hard to quantify all of these things whenever it comes to the amount of time, but we can guarantee you based off of this data and really, again, the information we've gleaned, that it is a manpower issue and it definitely causes us enough time and energy and effort to put into this that we can definitely minimize and better serve. I mean, if we're going to the same resident 62 times on multiple occasions, we're clearly not solving the problem.
Right.
And so what we're saying is we need to solve the problem in a way that makes more sense. And we're clearly not doing the right things, or we're not giving them telling them what they want to hear, or whatever, something in between. And so that's really what we have learned as we've gone through this. And that is emphasized here in this slide as well. You know, there were 12 responses 5 times or more. I mean, there were 62 times we were multiple responses. I mean, again, the deputy chief and I talk about it, you know, at length, and we say, you know, clearly, if we're going to the same house 5 times, I mean, that's not getting them what they need. And not only that, but we're not able to get them what they need in terms of resource standpoint. And we'll talk about, as a social services coordinator, they're able to interrupt that sort of progression and in that cycle and say, wait a minute, what do they need? What can we do for them? They spend most of their time developing relationships. And Jordan will tell you, you know, as we sort of, you know, he adds to the conversation in the next couple of slides here, that you'll see that that's really the benefit of having it. They develop contact, they develop resources, and they know Bob and Sue and Ed, and they know sort of first name basis of who these individuals are. And they're able to get them to bring to bear the resources they have. And that's really the benefit to having somebody coordinating that, really emphasizing that point. Yeah, if you could, yeah.
So as Chief was saying, having a social services coordinator that can be there for these crisis calls, you have a subject matter expert to respond to these behavioral health emergencies. When that subject matter expert responds, co-responds with an officer after the scene is safe, of course, they can properly assess and identify the appropriate need and refer that person to that resource or service as needed in a lot more efficient manner, which can reduce that on-scene time that Chief was just mentioning.
And that's really the huge benefit. You'll see that, we've looked at a number of different things. And again, we talked about it in our first conversation we all had a couple of months ago with the various models that are out there. And we know that there are various models at various parts of the cycle of interaction. And as we go through this, you'll find that this is the earliest upstream we can get in this conversation and in this interaction. And we feel like that's also the benefit we have because we are the first to be called, likely, or somebody in our arena is the first to be called, whether it's, again, public works, whether it's inspection, whether it's the fire department. We will have one of those entities being the first to be contacted and say, hey, there's a problem here. My neighbor's grass has grown far more than it should. I think there's an issue. And something that simplistic where inspection goes out on a issue of ordinance violations, then it recognizes the need to call a social services coordinator.
May I ask a question?
Yeah.
On that, to that end.
Yep.
Oftentimes, right, in the context that we work, it is often, to your point, someone's called 911, someone's called code enforcement, someone's called, right, because there is an issue, right, that they have recognized, and it rises, in their opinion, to the level of, I want to call because this is either a health hazard or a nuisance or whatever it might be. Now, and maybe, I think the knock-on question is, but oftentimes we see our residents and we recognize that there is a problem, but we don't think it rises to the level of, I need to call 911 or code enforcement. I'm just worried. Does this, and I know we'll get into it, but does this model support that type of intervention as well?
Absolutely. We had that conversation with Jordan before this, and he can tell you that we asked him if citizens actually come to him or come to the department, and because they've got such a vested interest in the municipality itself, because he's an employee of, people see him, they trust him, and he can tell you more with regards to people approaching him about it in a non-police manner.
Absolutely. We have a few different referral avenues. One is through the police department itself. So if an officer sees a need with a person they come in contact with, we have a referral system set up where they can send me a referral. And when I get into the office, if I'm not in there, I can tackle it that way. We also have a community-based referral. So if somebody in the community notices someone struggling, someone not doing so well, they can reach out to that person and let them know of my services, or they can contact the township and let the township know. The township can let me know that I can contact that person, because this whole program is based around that preventative measure, preventing that crisis from happening where all the minutes are taking up all the officers' time. And in using that preventative measure, we reduce the call volume and we can increase the well-being in that.
Yeah. And I think it all points to exactly this, our next point is, there are acute things that happen in the community to people, whether it's grief and loss, whether it's, domestic issues, divorce, other things that are more acute, where people need help with, but they don't know where to go. So those acute things are equally as important to us from a overall community safety standpoint, as are the long-term issues such as mental health, such as again, early onset dementia and late stage dementia has always been a real problem for us. One of the examples, actually, Jordan relayed not sure what happened there. Jordan relayed a call regarding a individual who literally was that, it was a elderly person and they just don't have any family around. And next thing you know, that's kind of how it presents. They're calling us, they're giving us sort of a problem that really doesn't make sense. And then next thing you know, he or she are able to go in and really kind of deliver those services. And that's also, you know, the other thing that we've run into in terms of, for us, we are a resource community. Most of our residents have resources. And so a lot of times social services aren't exactly quick to deliver those services to those with resources. And so we found that to be a problem at times. And I can tell you that having an advocate to help the vulnerable population is really going to be instrumental for us to continue this and really make this happen.
Well, to follow up on Commissioner Flint's question, I mean, the idea of a wellness check. Where you knock on that door and you don't know what's on the other side of that door. Is that envisioning this person to do that, or maybe that's a little too risky yet for that person?
No, we would always make sure that it's safe, of course, for
Secure the same.
non-uniformed personnel to enter into a scene, and we would stay on scene until that's resolved. But the point being that, so we don't have 2 or 3 officers who have to stay on scene. Now 2 can leave, 1 can stay, the social services coordinator can come in and work through it that way.
Okay, thank you.
So really, and this is kind of, and George, again, you can talk more to this. So this is what the smorgasbord of services that a care coordinator can provide. Again, they can do acute care, they can do crisis intervention, meeting people where they're at. And again, maybe Jordan, you can expand upon this in terms of sort of the battery of services that are offered and what we can do for them.
Absolutely. So a social services coordinator, their primary role within the township or community is to provide comprehensive social services. And with that, the services are there on the screen. The most important one probably, I would say, is the crisis intervention. As Chief was talking about, I'll kind of explore a little bit more into that call. It just happened over this past weekend. We had an elderly woman in her 90s who had fallen a couple times over the weekend. And she was actually down for more than 8 hours. The first time, the second time it was overnight. It was an undisclosed amount of time, but the officers were able to send me that referral. I was able to reach out, read the reports, and actually do an adult protective services referral. They were actually able to go out and do an assessment on her. And now she is safe and sound in a nursing home in Ross Township. So that one referral, follow-up from that officer potentially saved this woman's life, from tragedy. So that's just one example, and there's hundreds, and it goes alongside the spectrum of behavioral health, from mental health to substance abuse to domestic violence, to homelessness, to food insecurity, and a whole bunch of other things. The assessment and referral, that's another big one that we do, especially on scene when we get called to these emergencies. Like I said, the social workers have an expertise in a variety of different areas where we can properly assess and identify the need and be able to refer that person in a short amount of time, in a shorter amount of time than maybe an officer would. And that goes to another benefit of the program. Having a social worker within the police department, we get to debrief after that scenario, after that crisis. And now the officers are asking, hey, what did you do? What did you see? And the social worker can get together with that officer and maybe explore some behaviors, some mannerisms, some things that that person in crisis may have said, so they can use that in their next call to help reduce that call volume and help facilitate care in a more effective manner. Case management as well. Case management is a huge part of being a social services coordinator, especially helping getting people into treatment. And I know Miss Mary, she has a lot of experience with case management, being in the hospital setting. So it's not easy calling insurance companies and making sure their insurance lines up with this treatment center. And that's something that we can do following the crisis incident with the officer. We can take that person, we can sit down with them, we can call the insurance company, we can call the treatment centers and figure out what's the best resource, intervention, and need for what they're currently going through.
One example that stuck with me, that I think is interesting, right? And Chief Haberman and I have spoke briefly about this, was the idea that in many cases, people, for argument's sake, are mobility challenged. They can't go get their medicine. How does this help? Right? Because oftentimes, right, that medicine is a critical piece of mitigating a future crisis. And they just can't get to the pharmacy. How does this help with that?
So that's where the social worker has the expertise and the knowledge of the local resources. To know that if this person has Medicare or Medicaid, there are services which insurance will pay for delivery services of their medications. And we can set that up and that person can either get a ride to the pharmacy to get their prescriptions picked up, or sometimes there are services where the pharmacy can send the medication and drop it off to the patient's residence.
Or the other example being getting them to their doctor's appointment.
Correct.
Um,
There are services that will come and that will help that disabled person you get in and transport to local pharmacies. There are services for that as well. The services are there in the community. The resources are there. Social workers have the knowledge of the resource and are able to facilitate that they basically bridge that gap there.
So
they're-
ultimately, this is an exercise in really just, putting the pieces together.
Absolutely.
Well, you can see here to that point, our next slide is exactly that point, Commissioner Flynn. So we've talked a lot about enhancing our crisis de-escalation. We've talked a lot about increasing the connection of residents to client services. Obviously, we're trying to reduce the pressure on the criminal justice system by reducing the need for us to intervene by an arrest. And again, really, I'd like to bring Mary Ann and talk about the reducing the pressure on the healthcare system. We have a lot of time where they just get everything because no one knows what else to do. So with that, please, if you could.
Appreciate it. Good evening, everyone. I just wanted to make a comment or two if I could. I'm just so very impressed with the foresight of your team, looking at ways to try to help the community. Law enforcement and hospitals really are sort of the last ditch resort. It's an acute situation where particularly people in the community with mental health conditions that escalate or not getting the necessary treatment end up when we're not necessarily meeting their needs upstream to support their chronic condition. And so since 2019, St. Clair Health and St. Clair Hospital specifically has seen a double in the number of patient days, we call it, number of patients and how many days they have to stay in the hospital to support them for mental health conditions and concerns. And so that's obviously substantially increased through this pandemic. This is a national crisis issue. It's not just related to our local community, but definitely we're experiencing it in our local community as well. Probably the most impressive statistic is that what used to be about a third of our patient population with mental health conditions requiring hospitalization who came to see St. Clair had mental health conditions, but not necessarily with the condition of what was called psychosis, which is the more severe components of mental health illness. It's a condition that really reflects the things like bipolar, schizophrenia, affective disorders, and more. Today, as it stands, 71% of the patients from our community that we see that we are hospitalizing have psychosis. So it's a substantial increase in the complexity and acuity of the illnesses that we're experiencing. Because of that, when they come to the emergency department, usually is the case, because they've escalated, they're not in good control. They increase the potential for harm to themselves and also to others. That affects, of course, themselves, their families, and the community members around them, the safety of our community in general, and also even the safety of the staff of the emergency medicine department and our physicians. So we've seen an increased event associated with some violence as well, not just with mental health in general, but a substantial contributor as well. So being able to treat people well before they get to that very escalated acute state is critical. That's why programs like this are absolutely essential. To date, most of our 26 beds for inpatient psychiatric care are filled every day. And so we're under very difficult circumstances to decide who gets what bed when. And many times we see patients in our emergency department staying for days, trying to get placed into a hospital bed. Again, this is a national crisis and we're no different than what we're seeing across the country. On that note, St. Clair has been working very closely with the Chief and his team, and we really believe programs like this can be very helpful in reducing potential harm, also providing necessary support upstream, and even maybe reducing unnecessary hospitalizations. Consistent to that, as I've mentioned with the Chief, we're working on a new and innovative solution within our emergency department over the next year, a year and a half, we hope to have an expanded area, which we're going to call our Emergency Department Observation Unit, specifically set up for mental health patients from our community. The idea is to have yet another location where we can sort of crisis intervene, stabilize, treat immediately, and hopefully help them get back to their home and connect them through our social workers to community resources that will assist them longer term, hopefully reduce the number of times they come back to the hospital, just like you see law enforcement having to go to homes multiple times on certain patients in our community or people in our community. We're seeing similar things with patients coming back for hospitalization. So our goal and hope is that working together, along with other community providers in the area of mental health support and other social influencers, that we can make an impact for our community that will be very lasting in terms of the quality of their life. So thank you for listening to me today. I just want to again let you know that we're very supportive of this program, very inspired by your leadership, and very willing and wanting to be collaborative in this effort.
Thank you.
Thank you.
Thank you. And we always really appreciate the partnership. So thank you very much. So with that, I think that we've given a whole lot of comprehensive understanding of the problem that we face. And again, our partners I couldn't have said it better or relayed their message better in terms of what we're facing. The added benefit is we have told you before, and the manager has emphasized this, we do have a culture by design of wellness and people positive culture within the police department. And there is an officer benefit to this. And if you have a social worker in the building, they can be a resource for not only the 116 people that report to our office, but they can be a resource for the other members of the municipality staff. So there is a recognition, again, when you work with individuals every day, that you can see a change in their behavior and you can address those things internally. Again, I've never been a bigger believer in any concept than one that says that if your officers aren't well, they're not able to serve the community. And I think that for that reason, if you have officers coming in and they're not in the right state of mind, or again, they're in a place that is just not allowing them to serve the community best, that is not good for anybody involved in that situation. So for that reason, I think the byproduct of having a social services coordinator in the building, in the office, recognizing the change in behavior, recognizing these officers every day, I really think is going to be critical for us in our wellness program, and really giving us that extra benefit and really added layer of protection for them. And that's what it is, it's protection for them, to help them in their personal lives, to give them the tools they need in their personal lives. And then they can go out and serve the community much better. And I think that really we're big supporters of that belief. We've lived it. Again, on this panel, we've got 60 years of law enforcement between the two of us. And we can tell you with a high degree of authority that officers need help too. And this will be, a way to give that to them, Again, we've emphasized this and we'll continue to emphasize it, but, really there's a lot of varied reasons why this is important, and it really reaches all tentacles of municipal services, and it really reaches, everything that we do, from somebody applying for a permit to, somebody, coming here and paying their taxes. Everything, and anything could be a triggering moment for an individual going through a crisis. And that individual may be able to recognize something and forward that on to our social services coordinator in order for them to better serve our residents and to really indicate that. And I think that everybody here on the municipal staff can tell a story or a time or two of somebody being irrational and why they were irrational, and really not the reason they were here, but it was something else going on in their life. So with that, I think it's important that, we look to the forward and we try and implement something. So we're asking for funding to pilot a project beginning in July. We're looking to hire a master's level program coordinator to start this program off. We have proposed a salary of $85,000 with benefits. All in, you see on the white paper, the breakdown of cost. we would be at a number of around $70,800, would get us a half a year. It would also include startup cost of a computer, surface. The vehicle would be a recycled vehicle from our fleet that we would not sell. We would then donate to the program. So all in, we were looking at, $70,800 as an ask to seed this program in order to pilot this. Once we pilot the program, obviously, the deputy has already begun looking at policies and procedures and working with Jordan and others. There's a HIPAA component to this. There's a lot of things that are really unnavigated waters in terms of, from a police department standpoint, that we have to balance between the interest of the consumers and the residents we serve, and also with the social services coordinator and their ability to maintain trust. If we don't have that trust from early onset, we're not gonna have a successful program, and that's one of the things that we really want to impart. Again, with our officers and them buying in, we've seen continued support, continued buy-in internally, and in order to get that external buy-in, we have to really emphasize the trust with the program, and the program really will be maintained in the social services coordinator office.
And maybe putting
So-
St. Clair Hospital on the spot a little bit here, but if, I think St. Clair Health is willing to contribute something to the cause that would be most appreciated. Otherwise, you're probably not authorized to make that declaration, but if we talk about computers, tablets and such, there may be a way to working together on this that can help with the funding.
We appreciate your ask in that regard. I don't have the authorization at this point to respond to it, but I will say that the work that we talked about that we're doing over the next year and a half, we're also looking for support. And we've had some early support, so maybe we could find ways to get other contributors, grants and donors, if you will, to assist us. So I think that's where we feel like our time and energy right now has to be spent is on getting that observation area as an extension to the emergency department, better equipped and built to support behavioral health patients safely and do so in a manner that will help them de-escalate, be able to go back to their homes and avoid hospitalization. So that's where our time and energy is. And also we believe that's a great collaboration and support for the programs that you all are considering doing so that together there'll be a synergistic effect for our community.
And then also in your proposal, you mentioned Council Shannon.
We did. So one of the things, and I want to just take one step back if I could, sir. So one of the things we wanted to also emphasize is, we have already started developing things such as our job description and whatnot with Outreach Teen and Family Services has always been sort of our sister agency, if you will, for a number of years. Before shared services were cool, we started a shared service with Outreach as a truancy center, as you all know the history, and we've really become embedded with Outreach as a service. And I can't, go through this without talking about Outreach really putting in the forefront the need for mental health services in the community. They continue to serve our youth. They continue to really be critical in that vein. And again, we don't talk about kids a lot here because Outreach sort of has that covered. While we will come across some and we will refer some, and we have a great relationship to do that. I will tell you that, this wouldn't have been done or started or gotten off the ground had it not been with, our partnership with Outreach through the years to really develop, what we have as an early job description that we developed, a couple of years ago now, as we sort of entered into evaluating the models and seeing what we could do. And I really can't go through this conversation without really highlighting that point. And so with that, you mentioned Castle Shannon. So we have a number of willing partners who have reached out. I will tell you, we have 4 police departments that have reached out and would be willing partners tomorrow if we offer this service. However, and Jordan can attest to this, the danger we face or challenge, if you will, or hurdle is if we start a program as a proof of concept, trying to bite off more than we can chew too early. You can see our numbers are significant. And that's really numbers that we've analyzed through a data set that isn't maybe taking everything into account. For example, the welfare checks. We didn't account for welfare checks, so that may be another data set that we have to add to our call volume. So for that reason, and again, I think when we talk about this, everybody who's done this program has found it so successful that they really didn't know how they could do without it before. And so Castle Shannon is a willing partner. They are about a quarter our size. If we entered into it with them, they would be about a quarter in financially as well. They've mentioned that. I talked to Chief Truber at length about that. He talked to his elected officials. Should this program be something we can do, they would be about a quarter buy-in, on that number, that 70,000 number, using that figure as, you know, and again, we've gone down this road as a cooperative model with animal control. We know how to manage it. We've done it. We believe this would be so wildly successful that it would probably grow quicker than we could handle the growth. You know, I think it really, if this service were to be offered, I think this would be something that Scott Township has expressed very serious interest. Whitehall has expressed very serious interest, as well as Castle Shannon. So there's a number of chiefs in the neighboring areas. And again, Dormont Chief as well expressed it when we had early conversations as well. So nobody is averse to this problem. It's just a matter of growing too quickly. And I believe that, you know, you guys are living proof of that, you know, you've seen that a number of times already.
How many people do you have doing this in Ross?
So social services coordinators, so I am full-time and I do have 2 master's level interns who are there, each 16 hours a week. So 32 hours a week between the 2 interns,
Okay. What's your population in Ross?
around 33,000.
Okay, around the same size.
It's a very
Yeah.
similar. And again, we looked at Hampton's model. We weren't ready to pull the trigger because Hampton's a different demographic. And that's why I believe, what were the numbers, 352 contacts in the first poll?
312 in the
Yes.
first 6 months, I think it was, he reported to us. It's pretty extensive, the amount
Yeah.
of contacts, and what we want to caution ourselves on, it's like the chief said, growing too fast. So if we do enter into a cooperative model, are we going to do a disservice to the citizens?
No, I
of
agree.
Lebanon?
I don't.
So, and I think that's what this department is exploring now, and that's come up, and that's why we've addressed it. But Jordan can tell you that he's busy, and if he took on another municipality, you can speak, I don't want to speak for you, but.
Yeah, so like Deputy Chief was saying, if we were to take on another, you know, municipality, Ross Township would suffer. There would be some sort of service that I would not be able to provide as extensively as I would if I was just serving that township. So say, case management would be a great example. The case management was, I wouldn't be able to work as much with those clients to get them the help and resources and services that they would need if I had an extra 12 or 14 or even 15,000 members I was serving as well.
Yeah, Hampton, if I remember, has a full-time and a part-time. I think they might even have 2 full-time at this point now, part-time and an intern or something like that. They don't have outreach though. So that, I mean, and I couldn't do
Right.
I wasn't sure how the numbers would work, but they were doing youth as well as.
Right.
But I mean, no, I don't want you to go out and do this everywhere. We're gonna do it. Let's do it and be successful. Then we
Right.
take it out.
Right, yeah, let's, to your point, I think to start too big and then kind of botch it possibly, I think, you know,
Oh.
it doesn't bode well for the future, but let's get it right. And if it is right, it could expand to help those communities better later.
Right. Probably some benefit to allowing us to pilot the program, develop some data,
Yeah.
then be able to take out sort of real world numbers to the other interested departments. And, you know, I'm sure that there are some synergies through a collaborative agreement in terms of, I'm sure you like to take a day off every once in a while and, you know, so that you build in a little bit of redundancy so that if somebody's not available for this community, there's somebody else available to go here. But I think we could start as an in-house model and then offer what we've done based on data and experience to see if there is the opportunity to form sort of a larger collaborative.
So just real quick, if I could you address how your internship program works and what services they provide to you, not to the municipality itself, but to you in helping you alleviate some of this workload?
Absolutely. So I'll give a great example of a project that Ashley, one of my interns, is currently working on. So Ashley came on last August, and she noticed that we were having a high amount of overdoses. in Ross. So she is currently beginning to roll out a program to where residents in Ross Township and family members of those affected with maybe an opioid abuse problem, they could come and pick up naloxone, no questions asked. Just come and pick up and address that opioid overdose crisis that way to prevent further opioid deaths in the future.
So, yeah, no, it really is fantastic, and I think you guys are knocking out of the park what we have generally, I think, been asking for. This is phenomenal, right? I think, you know, again, outreach has set the foundation and the path for us, and so thank you. And you guys have taken this to that next level, so hands down, I'm all in on supporting a pilot. But I think you all know that I'm a finance guy. And at some point, this is a capacity discussion. This is a sustainable capacity discussion. Commissioner Silverman was very nice, saying we'd love for you to participate, St. Clair, right? But if you're getting benefit, right, economic benefit from reduced emergency situations, how do we understand that? And I'm not just asking St. Clair, I'm asking actually Chief Haberman.
Yeah.
And frankly,
Mercy
Chief
takes it.
Daniels.
Yeah.
And frankly, all of our public safety folks, even MRTSA, if we are mitigating these situations that are requiring public safety, including the medical system, there is economic benefit there that should be going to carrying the costs of these programs. I am very much willing to pilot, but at some point, we have to understand where that money comes from and why we are doing it. Otherwise, it won't be sustainable. Someone else will cut it. So how that's gonna have to be part of the pilot is understanding the economics of mitigation.
You know, the only thing I'll say is we will do everything in our power we would scrub every ounce and every unexplored dollar we get to look to help with this, because here's the bottom line. This is going to save lives. We have not only empirical data, not only subsets of data, we have real world experience in July of 2021 of an individual that didn't get the care he needed. And we ended up in a 200-round gunfight with him on Gilkison Road. And I can tell you, clear as day, by all accounts, and I'll be metric of that situation, we should be planning police officer funeral after that event. And by the grace of God, and by the good training, and by the good effort, and by the great response of those officers on scene that night, we did not. But I will tell you, we believe in this more than anybody could ever tell us or we could ever read in a book from those examples. And I will tell you, this program will save lives and will prevent people from going into crisis and will prevent our officers and this community from having to face those type of traumas in the future. So whatever we need to do this, I think we do. And I've never felt stronger about a program. And from that experience that we've had and from that real world experience we've seen. So whatever we can do to do our part, we're committed to doing.
I'm supportive of the program. Don't get me wrong, I have to ask the budget questions, because in the end, gotta come up with the dollars somehow. I'm trying to follow the page in your presentation and reconcile, say, for instance, I'm looking at the numbers here, you mentioned about an annual salary. And so I'm trying to pull all the numbers together to see, like, you've got initial cost, a proof of concept, approximately 61,000.
Right.
Your total cost is 70,800, the annual salary is 85,000. So just.
So all in cost, the all in annual cost of this program would cost you somewhere in the neighborhood of $135,000.
Yep. I was gonna say that.
Okay, so, yeah, so that's what it is. So it's it's 85 with benefits, which is 122.
Yep.
And at 122 plus,
Yes.
a budget for, for
kind of
gas, for
Yep.
operating costs
Right.
is around the number of $135,000
Yep.
annually. Will get you somebody to deliver a wonderful service to our
Right.
residents and really gives them a leg up in terms of managing, dealing with the crisis of war.
And then that 135K is the total cost regardless, that's 135. If it's 25% from Castle Shannon and take X percentage from St. Clair, but it's starting with that 135.
Don't feel any pressure or anything.
For 135, the worst case scenario.
Nails on the side, so got a timeshare for you.
So 135 is worst case scenario.
Yeah.
And I think we could talk about we are exploring grant opportunities.
Yeah, oh,
Yeah,
And things like that. So that'll be work on the grants cycle. I think is sometime this month. So it may not be awarded till next March or whatnot,
Right.
but we're gonna be exploring grant opportunities. We're gonna be exploring other types of funding that we are expecting to possibly pay for some of the equipment needs and things like that.
Yeah.
too.
Well, again, I go back to, a grant is a one-time exercise, right? And it's great to help with the pilot. At some point, we have to understand that I've diverted police officer time, and that's savings. I've diverted MRTSA time, and that's savings. I diverted fire department time, and that's savings. I diverted, emergency, emergency room time, and that's savings, right? And that savings, I would almost guarantee you run this analysis after a year of doing this pilot, you will have shown savings of more than $130,000, probably threefold.
Yeah.
But we have to understand that.
To Commissioner Flynn's point, our financial obligation to MERTS is based on call volume,
Right,
right?
right,
So we're currently 44 to 45% of
correct.
MERTS's call volume.
Yep.
So if we were able to somehow quantify that diversion of time, right, where those calls aren't going to MERTS and we're not
Yeah.
having 3 officers on a call versus
Only
one, or
yeah.
fires responding, then we can actually look at the numbers to tie that back to the cost. And
Right.
give us sort of the cost benefit
Right.
analysis, if you will, of having the position in place. And I can, for the commission, as is a standard request, anytime we add positions to the budget, you've
Mhm.
requested a 3, 5, and 7-year look, if you will, projections. So you have a full, because that's an employee cost is a
Yeah,
legacy cost.
Oh, yes.
right.
So you want to have a true understanding of what the
Good.
cost is that will have finance.
Again, I go back to there's so many opportunities here, right? This is a program I see growing.
Oh, yeah.
Yeah, shh, I don't want to do that. Yeah, and I do think that we have a great example with MERTS.
Yeah.
We have a great example with the work that Andrew McCreary is doing in from finance with Dormont and the other communities that are coming on. These shared services models are great, but we need to understand the core structure of the model, right? Because we all need this, right? You guys have all articulated this, and I think the community sees it and will be really excited when this comes in. How do we sustain that? A grant won't sustain it, right? I hire an employee and then I hire 3 more because it's going well, right? And we want to expand and we want to build capacity for this type of program because it is saving saving lives. And I don't mean to discount this. I think in financial terms. It's saving lives and it's saving capacity within the system that would have to be diverted to that. If I can understand that, I can then justify, not just to this commission, but to future commissions. Right? That this is an ongoing investment that is a true benefit to the community, not just a service that is being offered on top of a tax base that isn't getting any quote unquote benefit. Right.
And I take, building on what you said of saying, because I think we agree, yes, would be a great thing, really, yes. How to make the funding sustainable. And that's, because as far as concept, you kind of had us at hello. It's really getting to how do we try and have this, Commissioner Flynn's point, not just a one-time grant. How do we try and set this up? This could be an ongoing process.
May want to pull Representative Miller into this conversation.
Yep.
He's obviously got a passion for this issue. He does a mental health and disability summit every year. It's coming up.
And to his credit, he has been, we actually talked last week, the manager and I, with him. I mean, he's been in sort of monitoring this every step of the way. So I think he would be interested in sort of that next level of commitment.
Mhm.
Definitely would be an advocate,
Mhm.
and has access to resources that obviously
Mhm.
we don't through the state.
Mhm.
So again, another avenue to pursue, I think.
Just one other point, I do appreciate how important it is to look for in terms of sustainability. And, our board of directors, very similar people from the same community, had to make a very difficult decision too about, the expansion of our emergency department, specifically for behavioral health, mental health patients. And to have, substantial sizable commitment to make that happen. That's why I said that's our primary focus, because we believe even with programs like this, we may still see an uptick. Just to make sure I'm clear on that, in terms of the number of people who are gonna need emergency de-escalation and treatment, we want to be prepared for that. So that's where we're gonna put our attention, and rightfully so.
Yeah.
Those board of trustees, or members of our community understand that. We actually may see an increase, because we'll be a critical triaging, assessment, and stabilization process. So please keep that in mind, as we also will learn and see what more needs to be done in that regard. But even though it may reduce the number of hospitalizations, we have so many, so unmet needs in terms of demand in this at-large region for mental health admissions. But it actually isn't, that's a negative, if you will, for the hospital. We think it's the right thing to do to keep people out of the hospitals. And so, our board has weighed in on that and has fully committed to that, and very encouraged by this opportunity to collaborate together.
Novel idea. Let's go to the insurance companies and get money from them. Blue Cross Blue Shield,
We
PNC?
would welcome
Oh, yeah.
any and all of the above.
Tell you. Yeah.
So,
Great, thank
all
you
right. yep.
very much.
Yeah, thank you.
I'm gonna
Thank
hand you this.
Great.
Only because I got this in the mail. Of course, I didn't respond to it at all,
Okay.
but it's just another example of trying to go after senior citizens for cash.
Okay.
My husband wanted me to make sure I give it to you. So there you have it.
You did it.
So I didn't do anything with it.
It's important, you gave it to him.
I want to go back and make sure that wasn't a parking ticket. You
This letter telling me about money.
Right, lanes.
Hold on.
Right, sure, thank you. Perfect. Oh, Gabe, is up next? Yeah, thank you. Thanks for coming out from Ross. Appreciate it.
Well, thank you.
Yeah.
Thank you.
Now moving on to the fascinating subject.
Gateway.
Da-da, da-da, da-da,
down, right?
come on down.
Good news, good news at least.
Uh-oh. Good news, huh?
Lost your audience, but.
I did all left.
Things aren't nearly as exciting, I guess.
Boy,
So good evening. I'm happy to say here, so that last month when we met, we were going over the programs for both mill and overlay and reconstruction, and our plan was advertising the end of February, taking bids last Tuesday. That has all taken place. I believe you've each received
Yep.
letters from me for both programs. I'll start with the mill and overlay program first. As you can see, we had 2, 4, 6 streets in the base bid, 2 sections of Cedar, Florida, North Meadowcroft, Illinois, and Mississippi, as well as a number of alternate bids. If we were successful in getting good numbers on our bids, we could maybe elect to bring some of those alternates into play. That being said, we had 5 contractors pick up plans and specs. We had 4 that bid. The results are detailed out in the letter there, and there's a summary table on the second page of the letter provided. Youngblood Paving was our low bidder. They've done the program in Mount Lebanon multiple times in the past successfully. That being said, our base bid was at $367,576. Obviously, that's well under the budget number of the 443. So we, in talking with Director of Public Works, Finance Director, we looked at trying to maximize the budget to get to that number as close as possible. We did recommend awarding alternates 2 and 6. Alternate 2 would be the section of Shady over by the Public Safety Building, coming up to Washington Road, and the portion of Magnolia, kind of coming off of Cochrane at the dip, down where the dip
Yeah.
is, heading up to Savannah. Savannah, we had paved coming the other way on Magnolia up to Savannah, so it really ends, it finishes all of Magnolia at that point. Granted, that does put us slightly, those 3 streets do put us slightly over it for,
You're 3,000 over.
yeah, we were 3,000 over what the budget number is, but keeping in mind, we do have an item in the contract for soft spot repair. It's about a $5,000 item, knock on wood, knock on wood. Historically, we haven't had to use that because our streets do have a good base to them, that we haven't gotten into those soft spot repairs. So if history holds true, that is an item that hopefully we don't need. So although we're recommending something that's 3,000 over, we hopefully actually come in about 2,000 under without that item being needed. In addition, we do have an item in there for utility patches. Those are patches on streets where we, as a municipality, had point repairs for sanitary work that our contractor had completed previously. So we make utility companies, when they come in, mill and pave beyond those patches, when they do a gas line or water line repair. So and it is on our better streets, like our full depth streets, we do want to protect those. So it's only fair that we follow our own process and look to do mill and paving on those patches from sanitary work. Now that work would be funded from the sanitary fund, not from the mill and pave budget item, because it is truly related to fixing the street after a sanitary repair was completed.
Okay.
So our recommendation, as it stands, would be the base bid streets of the 6 outlined on the top of the list on page 1, and then alternates 2, Shady Drive East and Magnolia, and the utility patches. The purpose for tonight is really just to kind of review with the commission what the plan would be at the April 9th meeting, first meeting in April. We would look to have a recommendation for award that follows what I've outlined here tonight for mill and overlay.
And immediately following award would follow our notification process so that residents are aware.
Right.
I guess any questions on the mill and?
Mill and pave away. I don't think any of them are in my. Once you get them on my award, huh? Yeah, non-election year. You've done that in election, year, for God's sakes.
Right?
I got spun out as well, don't worry.
We paved, Madam President, based on assessment of road conditions, period.
I'm sure I won't say anything. So moving on to the reconstruction program. Likewise, we had 6 contractors pick up plan the specs. We had 2 that actually submitted bids. We had a number of the base bid. There's Birch, Fernwood, Firwood, Mapleton, Meridian, Oregon, Raleigh. And then we added last year, if you remember from the presentation in February, last year, we had a
Yeah.
tree calming project in
Yes.
Arden.
Yeah.
And then when we went out to bid separately, independent of the reconstruction program, the numbers came in a little bit higher than what we had hoped. That being said, a lot of the items, and we ended up adding it into the reconstruction because there are a lot of like items in the contract. So this year, given the history of last year, we wanted to bid the Cedar Salem work as
Yeah.
part of reconstruction right up front, so we get that benefit from including it in the reconstruction item. So that was also included in the base bid, but it did have its own separate funding source for that.
$175,000 carryover that will fund.
Yeah. Yeah.
So that's a separate item there. And then we had 2, 4, 5 different alternate bid streets in there as well. On the second sheet, you'll see, I've highlighted the streets that we recommend. So it would be all of the base bid streets, the drainage that goes along with the base bid streets, and that's all as a preventative, one, to address some icing issues, and two, to prevent future icing issues and get all those roof drains tied into the system where we can.
Without the right drainage, you'll lose the street.
Exactly.
I
Yeah.
mean, it's absolutely the base. Gotta
Water
have-
is such a necessity, but it also is, it can be
gotta have
really
the right
damaging.
drainage.
So we did, we recommend the drainage that goes along with each of the base bid items. And then we had included for Cedar Salem, in the base bid, we included, waterborne, just like painting of the lines on the street for all the new, crosswalks and just the
Yeah,
demarcation on the
Yeah.
road to let, motorists know changes. However, in discussion with, Rudy, we thought that it would be a good idea because the thermoplastic paint lasts a lot longer,
Mhm.
but it doesn't really stick to existing asphalt, like older
Oh.
asphalt real well.
Oh, okay. I didn't know that. That's interesting.
So we included an alternate bid item to mill and pave the portion of the road that would
That's
have
the
the
new
pavement
Mhm.
markings. If we got good bids, we can maybe entertain
Okay.
doing that mill and pave and putting down the more long-term markings, whereas the waterborne, how often do those usually?
Every year,
Every year they have to be redone, whereas this would be something a little more.
and then it'll stand out more too with new asphalt. I mean, it pops, so.
And can we do something really cool with the painting? Look at that look.
Colorful.
Colorful.
Don't forget, whatever we do
White and
has to be
yellow.
replicated at some point in the future.
Yeah.
I
And
know.
it has to meet MUTCD standards as
Oh,
well.
for God's sake. All right, start looking in your pictures. Look in mine.
Just to make sure I understand that, so this Cedar Boulevard, Salem Drive intersection alternate bid, that's strictly that mill overlay and.
Yeah.
Nothing
And
else.
it's the,
Nothing purple, lavender, it just.
no, just the boring standard markings. So, but one item to note though, there was in the base bid, the 113,000.
Yeah,
There was the waterborne painting in
Yeah.
there that we would not award that item, which was a $12,975 item. So that 13 ended up becoming like 100,000 more or less. And then we add the 40 on top of it. So it's not the base plus the 40, it's the base minus 12 plus the 40.
And that includes the flashing devices as well, right?
Well, no,
No, that would be installed by,
But from a total budget, so let's work backwards. Let's say 100,000 for the Cedar Boulevard. The
Right.
face work, add in the 41, so you're at 141.
Right.
That still leaves us $34,000, $35,000 for the RRFB. Based on my conversation with Mike Haberman, he thought we could probably accomplish that somewhere in the neighborhood of about $20,000 potentially on a solar powered
Right,
without needing to run conduit and
the
wires.
flashing.
right,
Yeah,
yeah.
like we have
We'll
up
just-
here on,
Yeah, I know.
We'll do the
Of course, we
install.
could just raise it across.
we'd do an in-house install.
I'm going for the paint now. Now I'm going for the paint.
so that would, to Manager McGill's point, that would still leave us about 15 to the good on the
Yeah.
overall.
Oh, yeah.
the overall
I think,
budget,
I mean,
even if
it's
that
a
pushes
project
us.
we need to do, and longer paint is always better than paint not lasting as long.
Setting aside Commissioner Smart Wilson's request for a raised crosswalk. So just make sure I got the numbers, 141,000 plus the 25K.
Yeah.
Is that the estimate for the flashing light?
Yeah.
And for
Yes.
Public Works to install.
Yeah, in-house install, right?
Okay,
Mhm.
now it's installed. Okay, thank you.
Solar powered.
Right.
That's
Even
cool.
even with the trees and the shade. Shouldn't be a problem.
Go back from there, yeah.
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 Mike told me they just
Could be
did one
okay.
up in Cranberry, maybe. Maybe, when we were met with him on the field, they
Yeah.
just did one somewhere. And I
And
think
it works.
actually their old
Yeah, it's
electrician, they work for the company that provided.
Sold it.
I'm sure it doesn't take a lot of.
Yeah, no, it doesn't.
No, yeah, it's great.
There's no wires between them either. It's all wireless communication between
Yeah.
the two, which is great. Nice. You don't have to run wires under.
Oh, yeah,
under the
wonderful.
Yeah.
Yeah, that's cool.
Well, speaking of wires under the road,
No, you won't have, you won't have.
We go back to
You
underground
like the way the
utilities.
crosswalk was bad. Here we go.
Well, no, at some point, we
Yeah.
have this conversation of
Right.
reconstruction.
Put the wires down.
When are we gonna start running those lines to prepare for conduit? What's the process that we have to go through?
If you're gonna go all the way down to the base, can you put,
You're referring to like Duquesne Lights?
Yeah.
I'm not asking you to get them to put their lines in there. I'm asking to prepare the road so that they can run it when they are ready.
I think that's potentially a conversation, quite honestly, reaching out to Duquesne Light, saying,
yeah,
if at some point in the future you were to consider doing this, what do you need in terms of infrastructure underneath the road? So that we can start with understanding
Yeah.
of what that is.
Yeah, they're-
and what it costs to it.
They're usually, and this is just in other instances, they're usually, you have to have the 5-inch conduits with the pull ropes and it has to be dyed concrete around their conduits and things like that, but encased in concrete, yeah, with, and it has to be dyed red and things like that. So, but those are all things that we can have those discussions and kind of figure out where those, because they're gonna have transformers every so often.
so many feet.
So if we start now, could we have something from them for next year's program?
Yes, we have a discussion with them. I don't know how forthcoming they'll be with.
Don't know till
Well,
we start the
and-
conversation.
There's no commitment, at least as I think about it, on their part.
Right.
Right now.
Right, yeah, all we want
We
now.
we want to be prepared for the
Right.
day.
Mhm.
And every time we're tearing up a road,
Yeah,
I want to be prepared.
yeah.
And the idea is saying, if, let's say, the magic is 5-inch. We should do 5-inch. They don't say, oh, no, it's supposed to be 6, like, oh crap. Why didn't we put that in when we had the road all ripped apart? So we're just trying to get that infrastructure.
So we need to get a commitment
ready.
from them, right, and a
Yeah.
commitment from them.
Yeah,
Yeah.
As
to what
their
it would be.
specification,
Yeah.
Standard,
yeah.
Exactly.
depths,
So,
how deep it has to be.
I mean, I'm sure those are things they have to have because they put it in other places.
Put it in the
development.
places, yeah.
I think my first question would be, you know, not being familiar with how they do that, is it always in the roadway or can it be in the roadway even? You know, typically,
I
I
understand.
mean, we have
Yeah,
community,
we have
parts of the
sites.
community now are
Yeah.
underground.
That's right.
Electric and communication, but they're not in the right, they're not.
No, they're not.
They're outside.
Oh,
of
so we need to
the
think about this as part of our sidewalk program.
Well, no, I mean, some of them are in the.
It could be.
They might work better there.
Yeah, that's fine too. Yeah, that's, we can throw that in this mix too. I don't care, right?
Yeah.
It's how, is it part of this? Or is it part of sidewalk program?
Yeah.
Or how
Just
do
wondering where it
we develop, you guys get to a point where you have the knowledge, where we can develop and adopt a policy
Right. Mhm.
that says this is going forward part of the base assumption of reconstruction or whatever it is.
And it'll require talking to the cable companies too, because anyone on the wire will, or on the pole will have to be.
Yeah, just please tell them that we're not asking them to do anything.
to your point of,
We just want to
we
understand.
gotta research first, so
Yeah.
at least.
Yeah, so we know, yeah.
Just know, and like my involvement with them, just replacing a pole with their permitting, they have tons of engineers that design and sign off on those things. There's 2 or 3 sign offs on those to make sure that their liability
Yeah,
is
sure.
covered on their
Yeah.
end. So that'll have to be part of the conversation too.
One other point, just because Commissioner Silverman asked me the question, thank you. And Mr.
I
Stugal
forgot what the question was.
reminded me of the process. Commissioner Silverman's question was, for street reconstruction, we are closing something that is, I'll say under budget, 168,000, somewhere in that neighborhood. When I talked to Rudy reminded me that traditionally is the approach that we take, because as we move through the streets, we get a better understanding of what our true cost is going to be. And if that capacity looks like it's still going to be there, we have the ability to do a change order to
Right.
add in an alternate,
Sure.
as long as we don't exceed 10% of the total value. of the cost.
Spend up to the budget, up to the number.
Yeah.
Yeah, things happen, you get into a street, it's
Right.
0-4 partner, but you get into the.
Yeah, the big, unlike mill and overlay where we typically don't have the soft spots, when you rip out the road and you're down to
Yeah, yeah,
the
yeah.
dirt, that's
Sure,
where you
that's
really expose
fine.
yourself.
Yeah.
Soft spots, and that's the unknown that
Right.
can open you up, so we don't wanna, we haven't historically awarded to the number. But there are 2 streets that would kind of fit in there as as either Craig Court or Baton Way, that are both about 100,000 each. So as we get further along the program, I would maybe consider one of those as being a potential alternate, yeah.
Sure.
If it's Craig Court, there's a slightly different discussion just because that's a brick.
I know,
Street.
I know. I'm well aware.
And we do
But not for the
have,
rest of
we do have,
Pretty, that one could go because it's such a mess. It's
we
bad.
do have an item in the contract, and that'll be a different discussion too, but if we were to change order that in at a later date, we do have an item in the contract as an alternate to palletize the bricks that we
Yeah.
could save.
Oh, yeah, absolutely. I mean, if you're gonna take it out, which is fine, we wanna save those bricks because Rudy and I do not want another park entrance day. Well, should I call that a week? And I think they were going after you next, so really, you wanna palletize them.
So we do have an item in for that. It would
Yeah,
just,
definitely. Really need to save them.
so that being said, on the third page is just kind of the, as Manager McGill highlighted, kind of
Yeah.
the effect of the recommended award on the budget as well as our estimate for each of the items. And then just to re-highlight one of the items to Rudy's credit, on the budget for the streets, we have a $230,000 item in there. And that is based on commitments from the utility companies, both on Mapleton in the tune of 150,000
Right.
and Oregon Trail in the
Sure.
amounting to 80,000 to offset some of those costs. When you look at the actual cost of Mapleton and or Oregon, the money that we're getting from the utility companies is about a third of the overall cost for our reconstruction
Yeah.
costs. So it is substantial and it is offsetting a good portion of what our cost would be.
And it really wasn't that much of a, inconvenience, I'll call it, or whatever, because everyone drove on it since they patched it up, so it'll be nice last time.
We had a presentation about, asphalt uses a certain amount of regrind, word, but streets, are we going to be able to affect some of that? We're not quite
Don't know.
there yet.
So we were talking about doing it in Public Works, the high wrap material.
Correct. We wanted to start with a smaller sort of pilot
Okay.
project, Steve. And be able to gauge sort of the, I'll say,
How well it
what it's gonna
wears.
wear and
Yeah.
those types of things. So Gateway's still working on that.
So we're working with the contractor that came it was last year, the contractor that came that did that presentation. We're working with them to work on an area that we can do a pilot project within the municipality. We were actually thinking possibly maybe down at Public Works in an area down there where it gets a lot of heavy truck traffic and things like that.
One of the other areas we talked about was potentially at some point, maybe the rec center parking.
Or that way, yeah, maybe,
Yeah.
yeah.
That
That might have been where, yeah.
Those are some areas that are gonna need that.
I know it was not an area that was necessarily right in the main street, but just somewhere where we could gauge it a little bit better.
Test that new pavement.
Oh,
So we are working with it.
I didn't think about it. It just hit me. I'm slow sometimes, not often, but occasionally. Great.
So likewise, we would be, if the commission is agreeable, we would also be looking to provide a agenda item also on April 9th with this recommendation to move forward.
Okay. Yeah. Fun and dandy. Have to make that meeting too long. Some of us have to get up at the crack of dawn the next day,
Oh, that's right.
right? Yeah, all right. Thanks. Always appreciate it. Thanks, guys. Boards and authorities?
I goofed last time, the outreach fundraiser is actually Friday, the 26th, not Saturday, the 27th. So
Oh,
April, it's actually that last Friday in April, not the last Saturday. So hopefully it doesn't affect anybody who's wanting to or be able to attend, but again, that's Friday.
fabulous. Anything else?
Sorry. The planning did not meet, there's nothing to, planning board, there was just nothing to evaluate, so planning board did not have.
And MRTA meets tomorrow night and the new director started Monday?
Yes.
Yeah.
The executive director started Monday.
Great. Good, we're all looking forward to that. Seems quite qualified and fingers crossed, he does a great job. He likes numbers. He's a real numbers guy, which is great because financially, it's a tough nut, so.
Looking for a business manager and he's got the numbers
Yeah.
background.
Got the numbers background. Jeffrey,
My last, let's see, the ESB kind of, well, they wound down and now the next one starts soon. So, yeah, there's not much business that took place then at the last meeting and then partnership meeting, the last one, I think I attended virtually. We had some updates on things going on and you know, some of the commercial tenants, but not too much to update. And then yeah, I know that Eric mentioned that there's going to be an upcoming conversation about parking on Beverly Road, some concerns over there by some of the merchants, but well, time will tell.
yeah. Andrew, anything?
I am very excited to attend the first mobility board meeting coming up.
Yeah.
Connect is busy as ever, following on our conversation with Chief Haberman, LEAD, which is a sister type of structure, I would say, continues to expand. Yeah, I think they're up to 10 different communities now. So it's fantastic. Again, this challenge is being recognized and you know, there are different models that are being implemented, which is fantastic. I think it's good to see all the different approaches people are using. Hopefully we will learn from them and they will learn from us.
Yeah.
I know that solar is on our future agenda for us.
April 9th.
April 9th. So I will save that for that conversation, but suffice it to say that, you know, Connect is working very hard to move solar forward. They are working with the county because the county is now working on developing their own climate action plan. Connect, obviously, as you probably know, already developed a regional climate action plan, so they are going to be heavily collaborating with the county, you know, and helping them get moving in a lot of spaces. So lots of different things happening at Connect. I would encourage all of you, if you are ever interested, it's a great group. Please come attend a meeting, an event. They are worth going and they're a neat group of people.
Cool. Jeff and I attended our last newly elected officials class on Saturday at the new South Fayette Municipal Building, which is pretty nice, pretty nicely done. Yeah, it really is. We heard a lot about sewers being the biggest topic of discussion. Always interesting, always fascinating. What else about that? Anything?
Learned a little about the,
Oh, Sarah Namarato was there.
Yeah.
She opened it. That was nice. I don't know if, you know, Rich Fitzgerald used to do it in years past, but Sarah did it this year. I asked her the question about, how, because all the buildings downtown are being reassessed at lower rates, how that was affecting the county budget, and did they anticipate that they would reassess the entire county? She, like every good politician, dodged the question. And not completely. I mean, she explained how they had enough money in reserves to cover the dip in the tax coming from the city, at least this first year. And that we were the only state that does not, or the only county, one of the
State.
state, yeah.
Doesn't
that
require regular
requires
reassessment.
regular.
State.
Mhm.
So just thought I'd ask for our benefit, but got nothing.
But she was delightful when she said it.
She was just charming as could be. Library is doing very well. I had a library board meeting. They have their upcoming garden tour, and yeah, I should have written it down and I didn't. It's in May, along with the plant sale. So please think of contributing. Word pit. Okay. Off and running. Yeah.
Question.